Hello, it's Dr. Stacy Francis here, and we are going to talk today about managing menopause. I'm Dr. Stacy Francis. I'm a chiropractic kinesiologist in Bloomfield Hills, Michigan. I am a functional medicine practitioner for lots of people in lots of different areas, not necessarily in the Metro Detroit area. I'm a public speaker and I'm the published author of The Supercharged Method, Your Transformation from Fatigue to Energized. And you can find me at specificwellness.com. So, what we're going to cover today is hormone balance, strong bones, heart health, and so much more. Let's start with strategies for balanced hormones. It all starts with a hormone called pregnenolone. I bet you've never heard of it. It's rarely talked about, but it is so important because it is the hormone of memory and the precursor to all the other hormones. It comes from cholesterol. And cholesterol is very important because without cholesterol, you don't get pregnenolone and you don't get any of your other hormones either. We need at least 140 milligrams per deciliter of total cholesterol to make pregnenolone. So when you look at your lab test, when your doctor takes your blood work, and you look at your total cholesterol level, it needs to be at least 140 to make appropriate hormones. So with the use of statin drugs and trying to get cholesterol lower and lower, we want to make sure it doesn't go too low. The three estrogens. Did you know that when we talk about estrogens, there's actually three separate estrogens, and we talk about estrogens as if it's one, but it's actually three separate estrogens. The first one is estrone. It's called E1, and this is what supports sexual development when we're young. It's never replaced when we're older since it can contribute to breast cancer as we age. The second one is E2, and that's called estradiol. It is so important. It actually does about 400 different functions in our body that we need and that we utilize every day. E3 is estriol, and that helps prevent breast cancer. So when we replace hormones in older years, when we're hitting perimenopause or menopause or surgical menopause, then we're going to replace E2 and E3 in the balances you need specifically based on lab work. Estrogen, so many different things. It slows down the breakdown of bone, which means that when it's in appropriate levels, it's going to prevent osteoporosis and osteopenia, which is thinning of bone. It's going to lower cholesterol. And we know as we get older, cholesterol goes up, but a balance of estrogen can help keep it down. It lowers blood sugar, lowers blood pressure, and it helps maintain memory. So important. And people, we care a lot about our brain as we get older. It helps with weight management. It is heart protective. And in men, it inhibits growth of cells of the prostate, preventing prostate cancer. With the right balance of bioidentical hormone replacement therapy, which is the hormone replacement therapy we would only do because it is exactly a replica of our own hormones, it can help with hot flashes, vaginal dryness, painful intercourse, mood changes, sleep disorders, anxiety, and decreased sexual desire. It's for bone health and brain protection. We need to replace hormones as soon as they're needed. Not when we stop having periods, but when our levels are actually deficient and we need to bring them up. Why you should not fear bioidentical hormone replacement therapy. The study that scared the pants off of women was done with synthetic hormones. And synthetic hormones do indeed contribute to higher risk of cancer, heart disease, stroke, blood clots, Alzheimer's disease, asthma, and dementia. And those were the only ones prescribed for years for women, not bioidentical. But bioidentical hormones match the hormones produced in the human body precisely. This means bioidenticals can communicate with the appropriate cell receptors and perform the tasks the body requires. evidence continues to show that bioidenticals, when properly administered, can be virtually side effect free and completely safe to use. Estrogen is stored in fat cells. So if you're carrying around extra fat, you may not lose it immediately at menopause. We only replace the hormones we are deficient in, and estrogen has to balance with progesterone. Symptoms of progesterone deficiency would be anxiety, irritability, insomnia, depression. Bladder problems are a big one because as we get older, we get more prone to more frequent UTIs. And sometimes we just don't feel good. We don't know what it's from. We don't actually get bladder pain, but we have a bladder infection. And so the elderly, especially, might feel dizzy, they might feel disoriented, and that is enough reason to check the urine to make sure they're not having a UTI. Because as we age and our progesterone goes down, we will be facing more bladder problems. Digestive issues are one of the progesterone deficiency symptoms. Also, premenstrual syndrome, polycystic ovarian syndrome, and premenstrual dysphoric disorder. And when we have these, we want to make sure we bring up progesterone. This doesn't just happen in menopause. This can happen at any stage in life. This is how we help women get pregnant. This is how we help young women get through PMS and things like that. If they're deficient in progesterone, it is healthy to add a bioidentical progesterone therapy to help them. Not all women lose testosterone. Although PCOS, or polycystic ovarian syndrome, is high testosterone and it drives up the risk of heart disease and insulin resistance, you may not lose testosterone your entire life and you may never need to replace it. Testosterone is needed for bone health, muscle production, and sexual interest. And just FYI, if you have a husband who is on testosterone cream and you do some belly rubbing with him, not knowing, you will be receiving more testosterone and you need to watch those levels as well. And same goes for if you have cream and you're rubbing bellies with him. And then we have our estrogen pathways. So important when we talk about detoxification, because as estrogen moves through our body, we dispose of it as well. But we want to make sure it's traveling through healthy pathways. 2-hydroxy is the OH. OH means hydroxy. So 2-hydroxy pathway is the healthiest pathway. And we want our estrogen to go through that mostly. And then the 4-hydroxy is the most dangerous pathway. When it goes through that pathway, and we have a lot of estrogen going through that pathway, you are more prone to breast cancer, ovarian cancer, and other things. Even men can be tested and they would be more prone to prostate cancer. 16-hydroxy pathway, you need a little for bone structure, but not too much because too much would also contribute to breast cancer. You want to monitor every 6 months via urine analysis. And I'm not just talking about if you are taking bioidentical hormones, synthetic hormones, or any other hormones. Even if you take no hormones, you do want to make sure that the estrogen you're producing or the estrogens you're getting from your environment, such as plastics, BPA, parabens, phthalates, those all cause an estrogenic response. And you want to monitor every 6 months via urine analysis, which we do in our office. We do this for you to find out which estrogen pathways you are utilizing to keep you safe. Enjoy those mocktails. Did you know alcohol is a risk factor for breast cancer? So if you have family history of breast cancer, you would be advised to avoid alcohol. Women metabolize alcohol at a slower rate than men. So 1 drink a day is max recommended for women, and 0 if you have family history of breast cancer. Supplements for menopausal symptoms would be Siberian rhubarb if you have hot flashes, and we have a great product in our office that works so amazingly well. People bring people in just to take that. Restless sleep. If you're having trouble sleeping, which is a very common problem, we want to support you in lots of different ways. And in my book, The Supercharge Method, I have a whole chapter on how you can have amazingly good restorative sleep. But some of the supplements you can utilize is melatonin, L-tryptophan, 5-HTP, magnesium, specifically magnesium L-threonate, because that crosses the blood-brain barrier, vitamin D3, GABA, L-theanine, and phosphatidylserine. And if you have vaginal dryness, my colleague, Dr. Paula Ruffin, created something called Butter for Play, and it is excellent to help with vaginal dryness. Melatonin is not just for sleep. It's made in the pineal gland in the brain, and in the gut, it's important for the immune system. Studies have shown that it improves breast cancer outcomes, including stage 4 cancer, with or without chemotherapy. So if someone you know has been diagnosed with stage 4 cancer and they're choosing to do chemotherapy, or they're even not choosing to do chemotherapy, using melatonin can actually help them have a better outcome. Stress hormones, let's go to that. Cortisol is a hormone that helps the body respond to stress. It's sometimes called the stress hormone because it spikes during times of high stress. Your primal brain, your primitive brain, is at the back of your brain. And that is all about survival, and it was what was developed first. And then our emotional brain and our evolved brain was then developed. Our primitive brain is always looking for danger, wanting to keep you alive and keep you surviving. And so it's going to hijack your evolved brain if it thinks you're in danger. And it's going to take all of your energy, all of your blood flow, and borrow it from your digestive tract and your peace of mind to go to your heart, your lungs, and your muscles so you can run fast or you can fight. Cortisol awakening response is on awakening, cortisol should increase about 50% in the first 30 minutes and then begin to progressively drop the remainder of the day. That's because when the sunlight hits your eyes, your brain says, it's time to get up, work, move, eat, survive. And so cortisol is there to bring you up and give you that energy. And then it drops off as melatonin increases closer to nighttime so that you can start to get ready to fall asleep. And cortisol continues to drop to very low levels at night, where they stay low during the sleep hours. We test this in our office. There's a test that we perform that allows us to see if this is in proper balance for you, if that might be one of the reasons you're having insomnia or drowsiness during the day. Factors that can affect cortisol: blood sugar imbalance or fasting a little too long between meals. Because when your blood sugar drops, it sends a message to your primal brain that you're in danger because there's a famine. You don't know when food's going to be there next. And it sends you into the stress mode. Poor sleep can do it. Excessive exercise can do it. Pain can increase cortisol. And a recent cortisol injection, or from a topical, from something inhaled, or an oral steroid use. So any kind of cortisone or steroid that you had been exposed to can, of course, increase cortisol. Did you know 50% of hot flashes actually come from stress? That is how pervasive stress is in our environment, and we want to make sure we address that. The supplements we use for stress, number one is always B vitamins. If you're stressed out, you're already utilizing your B vitamins, and you're probably running out of them. But we also want to make sure you have the B vitamins you need, which we'll talk about in a little bit. Ashwagandha is an Ayurvedic herb that is great. It's an adaptogen. And so it lifts you up and gives you energy when you need it and helps you sleep when you need that. L-theanine, we already talked about magnesium L-threonate because it crosses the blood-brain barrier and can decrease anxiety and help you sleep. Valerian root is another herb that helps you calm down and sleep, and we often use it when muscles are really tight. Let's move on to thyroid hormones. There is a very long list of thyroid hormones that I do in my clinic every time we do lab work. And the reason is because things can go wrong along this whole pathway. But unfortunately, many allopathic doctors will only test TSH and T4. And that's because that's the only thing that insurance typically covers for. But there's so much more to thyroid function. It can be bound, which means that thyroid is being carried through the bloodstream on the back of a carrier. And then right before it gets to that target tissue, it has to release that carrier and bind. That free hormone needs to bind. But T4 is inactive. It really doesn't do anything. It has to convert to T3, and that T3 has to be unbound and has to be free. So measuring free T3 is the ultimate how much thyroid hormone you actually have. And then if you have trouble converting from T4 to T3, we might see an increase in reverse T3, which is just as inactive as T4. Then we want to look at antibodies to your thyroid hormones. So TPO is thyroid peroxidase enzyme, and you can have antibodies to that. And that means your immune system is attacking it. Antibodies are part of the immune system, and they're little attackers, and they do that for a reason, to protect your body. And thyroglobulin antibodies, TGAB, is another factor that the immune system can attack. When we see these as being high, we know there's an autoimmune situation happening where something went wrong and your own body, your own immune system is attacking your own body. And we need to correct that. And we correct that not with giving you thyroid hormone, although sometimes we do that, but mostly it's we decrease inflammation and we decrease that immune response. So what are the symptoms of hypothyroidism and hyperthyroidism? Well, for hypothyroidism, it's often fatigue, weight gain, trouble tolerating cold, joint and muscle pain, dry skin or dry thinning hair, heavy or irregular menstrual periods or fertility problems, slowed heart rate, and depression. And hyperthyroid would be anxiety, difficulty concentrating, also fatigue, frequent bowel movements, sometimes getting too hot and sweating a lot, goiter, which is a visibly enlarged thyroid gland, or thyroid nodules, but that can happen also in a hypothyroidism, hair loss, which can also happen with hypothyroidism, hand tremors, and heat intolerance. When you have an autoimmune condition, you may have some of both of these, some hypo symptoms and some hyper symptoms, and it gets very confusing. But when you have both, then we suspect that it might be an autoimmune issue. Factors that impair healthy thyroid function would be stress or elevated cortisol, heavy metal toxicity like aluminum, lead, mercury, starvation, or even just skipped meals, inadequate protein intake, high carbohydrate diets, decreased kidney or liver function, inflammation. Inflammation is big because inflammation is at the root of all disease. Deficiencies of iodine and iron. Iron is needed to convert T4 to T3. Selenium, zinc, and lots of vitamins, vitamins A, B2, B6, and B12. All of this is necessary for thyroid function. 70% of those who have hypothyroidism don't know it, but they have autoimmunity to their thyroid gland, and we can test to find out. So make sure you have your TPO and thyroglobulin antibodies being tested. Moving on to strategies for healthy bones and heart. Let's start with bone. So there is a condition called osteopenia, which is lowered bone density, and osteoporosis, which is so much low density that you're actually at a risk for fracture. Your bone is active tissue, and there are two different kinds of cells that make up bone. You have osteoclasts that eat away at bone, and osteoblasts that build up bone. And osteoclasts, if there's too many of them, you will have more osteoporosis or osteopenia because it's breaking down bone quicker than you can build it up. We need a beautiful balance. When we take in vitamin D, it mobilizes calcium, and we need vitamin K to take the calcium and get it out of those blood vessels and into the bone and the teeth. In fact, you have most of your vitamin K residing in your mouth because of having to have strong teeth and wanting to have strong teeth. Calcium cannot be cannot stay in the blood vessels or the kidneys without causing kidney stones or calcium plaques. So we really want to get calcium out of there. And it's good for vitamin D to get it mobilizing because we do need calcium, but we need to get it to where it needs to go, which is the bones and the teeth, which is what vitamin K does. And vitamin K is so important because it really does help remove it from those soft tissues and decreases our risk of heart attack and stroke, which we'll talk about right now. But first, let's talk about what medications are given for osteoporosis. It's a group of drugs called bisphosphonates, and one is called Fosamax. And there's others that are commonly prescribed in this category. These drugs are designed to destroy those osteoclasts, so all you have left is the bone-building osteoblasts. But you need this beautiful balance to make healthy bone. It creates brittle bones instead that may look good on your DEXA study that evaluates your bone density, but you're more prone to fracture. In fact, side effects include gastrointestinal issues, esophageal irritation, kidney disease, atrial fibrillation, bone fracture, and even osteonecrosis of the jaw, which means the jaw bone dies. And that's a horrible thing to have. And many dentists will not do a lot of dental work if they know you are on these drugs because they know that this jawbone will not hold any teeth if it's that brittle and if the bone is dying. And esophageal cancer, which of course no one wants. Magnesium is also so important because it prevents calcium buildup in blood vessels, just like vitamin K. And building up calcium in blood vessels leads to clogged arteries. And clogged arteries, of course, lead to heart disease and stroke, right? Atherosclerosis. Magnesium supplementation therapy prevented fractures and resulted in a significant increase in bone density in 71% of women and stopping bone loss in 16%. Is your heart on fire? We want to check CRP levels, which is C-reactive protein levels, and homocysteine levels. Let's talk about why. Homocysteine is an offshooting of a conversion from folic acid, which is synthetic B9, into what the body actually needs, which is natural B9 or methylated B9 in the bloodstream. And 40% cannot convert it properly. Folic acid is often found in breads and processed foods. You might see it on the label as folic acid. Even your supplements might have folic acid. But if you have this genetic inability to convert, which we can test, then you're going to have this offshooting of this homocysteine, which is inflammatory specifically to the heart. 60% can convert to methylfolate on their own, but because that 40% cannot, we really do need to test. Magnesium intake will lower CRP levels, so it puts out the fire. C-reactive protein is a predictor of heart disease because it is an indicator of inflammation, and we test it every time in our clinic. And it is the inflammation and injury of the blood vessels that causes heart disease. Symptoms of a heart attack? For men and women, it would be chest pain and shortness of breath. But women specifically get more subtle symptoms like neck, jaw, shoulder, upper back, or abdominal pain. They might get dizziness and unusual fatigue, especially when at rest. These can be signs for what is known as a silent heart attack, and so you need to know about that. Calcium is important for the heart also because it stimulates the muscle fibers of the heart to shorten and contract, while magnesium helps the heart relax. It's a beautiful balance. A recent study showed that calcium supplementation actually increases the risk of heart attacks. This study and others have looked at individuals taking calcium supplementation in isolation without other key nutrients like magnesium, vitamin K, vitamin D to help balance them that play a role in calcium homeostasis. So, jury is still out whether or not we need to supplement with calcium supplements, but when we do, we want to do the best kind, which is microcrystalline hydroxyapatite, because that actually is what bone is made out of and not calcium carbonate. Vitamin K1 is the most common form of vitamin K in the diet and occurs naturally in certain vegetables, seeds, and algae like kale, Swiss chard, parsley, broccoli, and spinach. 90% of K1 turns into K2. Our bodies produce vitamin K2 from the bacteria in the intestines in a healthy gut environment. Antibiotic use can kill over 70% of the beneficial gut bacteria that normally produces vitamin K2. So important to have a healthy gut for so many reasons, and this is one of them. Vitamin K2 rich foods would be grass-fed meat and liver, fish and egg yolk, yogurt and raw cheeses, sour cream and buttermilk, sauerkraut, kimchi, and natto. Animal studies have shown that vitamin K2 not only prevents atherosclerosis, but actually has the potential to reverse arterial calcification. That is huge because everyone's getting really fearful when they get these coronary calcium screens and they see that they have high calcium in their blood vessels. Vitamin K can help reverse that. The Rotterdam study in 2004 demonstrated that people with the highest intake of vitamin K2 had a 50% lower risk of death from heart disease than people with the lowest rates of K2. Low vitamin K status is associated with osteoarthritis in the hand and knee. Make sure you're taking your vitamin K. Strategies for healthy bone would be good gut function for proper nutrient absorption, a whole foods diet with lots of different minerals and nutrients, one ingredient food, not processed food that has a list of ingredients as long as my arm. Weight bearing exercise is so important to build and maintain muscle and keep your flexibility. Vitamins D3 and K2, I hope I imparted how important that is. Magnesium glycinate, which you need about 550 milligrams a day of magnesium glycinate and magnesium L-threonate. So like 300 in the morning with magnesium glycinate and 300 in the evening of magnesium L-threonate is a great combination. And we do that often in our office. Calcium-rich dark green leafy vegetables is important. A healthy calcium level, we want to test metabolites to see what your calcium level is. Maintaining a healthy weight and stress management. Moving on to strategies for fatigue. There's many causes. There's blood sugar imbalance and low thyroid function, oxygen transport issues, energy production, and inflammation. And I cover all of this and more in my book, The Supercharged Method. You can get that at Amazon. Strategies for belly fat is a low carbohydrate diet, sufficient protein, healthy fats, managing your macros, which is the amount of grams of carbohydrates, fats, and proteins in your diet every day, getting good sleep, managing stress, avoiding over exercising because it increases cortisol, and cortisol contributes to belly fat, building muscle and bone with strength training. If you would like to learn the 5 powerful steps to overcome fatigue, how to identify and address your hidden causes of brain fog, an easy method for balancing blood sugar without feeling hungry or deprived, steps to regain your health and live a symptom-free life, get my book, The Supercharged Method. If you would like to test with me a complete thyroid panel, inflammatory markers, nutrient status, heavy metals and toxins, hormonal status, your risk of heart disease and risk of breast cancer. We do all those tests and more. And if you don't know, And you don't know if you don't test. So if you want to work with me, I would love to do that with you. Make an appointment with me if you are tired of wasting time with the same answers and solutions. You would like an ongoing support from someone who has been there and has the education to guide you. If you want your future to have strong bones, a healthy heart, and a brilliant brain, I'm here for you. I'm Dr. Stacy Francis, and you can find me at Specific Wellness. Thanks for listening. Have a great day.